Dan, your 8th nutritional principle is, if you're going to take a supplement, make sure that it is well absorbed.
Yes.
Okay? You want to be able to use whatever it is that you're taking. If you're going to pay for it and use it, make sure it's well absorbed. Now, I didn't take any supplements
Yes.
most of our married life, but I did take prenatal vitamins, of course, when I was pregnant with my kids, and that was for many years because we had 6 kids over, span 14 years between the youngest and the oldest. So I did take a prenatal vitamin.
Yes.
But other than that, I didn't have any experience with taking supplements, never thought that I needed any supplements, had no education about supplements. But then about 15 years ago, someone came into your office to talk to you about supplementation.
Right, a woman came in and introduced me to a line of supplements, and I through all medical school and all my medical training, never had any education in supplementation for our nutrition. No nutrition education for that matter. And so she showed me this supplement, and what I had to do is I had to try it for myself. That's the first thing. Can I like the supplement? Will I take that supplement? Does it agree with me? And then, because I had no education and I was getting asked so many questions from patients about what they should take and what they should avoid, I needed to get educated myself. So I had to go out and educate myself, not just on which supplements are the best, but what about the ingredients in the supplements? What was the science behind the supplementation? And when I learned that, I dove in so deep that I even became a teacher of that for even other physicians and health practitioners, so that they would even get some continuing medical education. So I was able to then take my education and even teach others about the importance of the use and safe use of supplementation.
That's the key thing, right? The importance of the safe use of supplementation. It's they're not all created equally.
No.
Okay, and there is dosing that is involved because everybody comes in different shapes and sizes, right?
Right.
So it's not necessarily.
It's not one size fits all for everybody. Plus their medical issues, wherever they are in their life, on their journey of health, can be different, and they might require different types of supplementation.
But what would you say, are the supplements that you talk with people about sort of day in and day out, kind of that general cachet of supplements that the people are always asking you about?
Well, it needs to be individualized, as we said. But as a foundation, a well-absorbed multivitamin is the great way to start, because good multivitamins will give you not just vitamins, but also minerals.
Okay.
And they're both important. You can't have one without the other. At the cellular level, in all our organ systems, we require many vitamins, especially the B vitamins, and lots of minerals for those cells to perform to their best. So multivitamin is a great foundation to start with.
And I mean, we never say we're not plant perfect, right? We are plant-based, but there are some people who are plant perfect. They are never eating any animal products, right? So these people are concerned about getting enough vitamin B.
Right, B vitamins are important because they come from the ground. Animals will eat them when they eat their food, and then it gets into their bodies, and then when you eat animal products, you gain whatever that animal ate. Sometimes it can be good things and sometimes it can be toxins. But the B vitamins from bacteria in the ground is primarily where we get our Bs, B12 specifically. But anything that is a complex B vitamin or multivitamin that is a good, well-absorbed multivitamin will have enough of the B vitamins in them.
Okay, all right.
Because we don't need much. And when it even comes to minerals, we don't need much, but we need to continue to supply our bodies with vitamins and minerals.
Okay, all right. What else? Multivitamin. What else would be, like I say, those that you talk about kind of, day in, day out?
Well, antioxidants are another great addition. we get those antioxidants with the colors from all of the plant-based foods that we eat, but especially during a transition, you might not be getting the variety that you really
you
need.
mean as people are transitioning to plant-based eating,
Right, from whatever
nutrition.
diet plan they're on to a
They
more
need to-
plant-based diet.
Yeah.
Again, we have good days and bad days,
Yeah.
and some days we really get those colors and other days we don't. So antioxidants are great because they help support our longevity. They help stop that rusting in our cells. I like to call it rusting because everyone sees that, you know, your car can rust, or people see oxidation in an avocado when it turns brown if you leave it out without putting lime, which is, again, a vitamin C from the citrus fruit will help that avocado from oxidizing, from turning brown. The same thing's going on in our cells. And although our body makes great antioxidants, and many of the vitamins like vitamin E and vitamin C are great antioxidants, we can always use more antioxidants. So along with the multivitamin, most would benefit from an antioxidant.
Okay, what else?
Well, again, transitioning, eating a plant-based diet, those omega-3 fatty acids, which are essential, again, to all our cells. They really support our nervous system because most of our nervous system is made of these omega-3 fatty acids. But all our cell membranes contain these fatty acids also. So supplementing with a good omega-3 fatty acid would have to be another addition to a great foundation of nutritional supplementation.
Okay, great.
And then we look at individuals too. And some individuals, depending on what their medical needs are, need specific supplements. For example, many of us could use vitamin D. We don't live, you know, in an area where we get enough sunshine that can even penetrate through our ozone to give our skin that stimulation to make our own vitamin D. So supplementing with vitamin D, for most of us in America, especially up here in the Northeast, we should take a vitamin D supplement.
I've heard that all of our cells need vitamin D.
They all have a receptor. I mean, most of us know about thyroid hormone and how important that is. Well, vitamin D isn't a vitamin. It is a hormone that our body makes from cholesterol, like many of our hormones are made from cholesterol. And when we don't get enough, then our cell function, especially at the DNA level, can be compromised. And so it's important that vitamin D levels are adequate.
Okay, great. And I know probiotics are another one that you talk about, and especially during certain times of our life where maybe we're taking an antibiotic
or
some
even if
other
we're
kind of
sick,
medication.
you know, we could be, you know, have a flu bug, or you know, just not be under the weather a little. The most important thing is that the microbiome, those trillions of bacteria that live within our gut, are well supported, and that's what the probiotics do. Probiotics are a collection, and good ones will have, you know, upwards of 10 billion to 20 billion colony forming units of an array of these probiotics, not just one probiotic or two probiotics. You're looking for that 5 to 10 different types of probiotics, bacteria that can help support all the bacteria in our gut. I like to look at these as being the players that make other players better. You know, like your Tom Brady's. They make everybody on the field better. And so these probiotics have been shown that they support even all our bacteria in our gut.
Wow.
And you don't have to take them forever. You can take them for 30 days, for example, if you're on antibiotics, to rekindle, because those antibiotics don't just, you know, fight the infection that we have, they also destroy our bacteria in our gut. So supporting that bacteria with a probiotic while you're taking antibiotics and then beyond, to make sure that the microbiome is back to where it needs to be, a probiotic is a great choice.
Gut health is so important. So many things.
They say the pathway to good health is through the gut. And everybody can just imagine that, because that's where we get everything. We ingest foods and sometimes whatever comes with that food. So good health is through our digestive system. So supporting that with a probiotic can be very important.
What would be, some advice that you would give somebody who might want to start with supplementation, or want to learn more about supplementation, they need a good resource. We're always about providing a resource for you so that you can learn more about this. And so what would you do? I mean, people go into a store, right?
Yes.
That sells vitamins and supplements.
And who knows what the person you're talking to knows about vitamins and supplements,
It's
and
kind of a gamble,
what type of
right?
education they've had.
Yeah.
So go with people you trust.
Okay.
And if you have a good relationship with a pharmacist, that would be a good choice.
Okay.
Pharmacists understand not only interactions with other drugs, but they also understand how things are absorbed in our body, what type of pharmacology goes on in our body. And so supplementation and dosing is so important, like with pharmacology, to get the benefits, to get the support that we are looking for, and pharmacists would be a good resource to start with.
You know, that's a good point that you make about the interaction. If people are on medications, there are some supplements that could negatively interact with a medication, or I've heard that some medications will actually deplete minerals from your body. And so you would want to, if you're taking those medications, to replace those minerals.
Right. The big one, and what probably the second or maybe even the most prescribed medication are the statins, the cholesterol lowering medications that many Americans are taking. And what we know about statin medications is they do deplete our bodies of CoQ10, coenzyme Q10. And coenzyme Q10 helps in our cells, that mitochondria, produce energy. And so people that take statins sometimes feel lethargic, don't have the energy that they normally would get, and so, or have. And so taking CoQ10 will help replace that depletion of that from your body because of the medication that you're on, that statin that you're on.
So if you're prescribed a medication, make sure that you ask your health practitioner if there is anything that is getting depleted by the medication that you're taking, so that you want to replace that, you know, as you're taking that medication. So that's really key. All right, so a pharmacist could possibly be a great resource for you in terms of, drug interactions and dosing, you know, maybe depending on their scope of knowledge, maybe even more than that. Who else may be a good resource? Like, you know, where else? Who else? You know, you want to get the right information.
Right.
So who else would be that person?
Different training gives us different backgrounds on what we understand about nutrition and supplementation. Integrative nutritionists. You know, and anybody that bills them or coins themselves as an integrative nutritionist understands a lot about nutrition. They've been trained in nutrition, and not only trained in nutrition, but also how to integrate not only our diets, but also with supplementation. So finding a qualified integrative nutritionist would be another great resource.
Okay, great. And as always, this is a great example of what I always tell you guys to do with anybody who's giving you advice. You ask them, that sounds really interesting. Where can I learn more about that?
Right.
And so make sure that the person who is giving you advice can lead you to a resource that is an evidence-based resource to support whatever their advice that they're giving you.
Right.
If they can't give you a resource like that, you may want to find somebody else to get your advice from.
Right.
Is that good advice, Dan?
That's great advice on almost anything that you hear from a health practitioner.
Yes.
Whether or not that person says, you know, you should take this medication, and you're kind of thinking about maybe I don't need it, ask them for more advice. Where can I read about this? Where can I find out more information?
That's right.
And also, if someone is recommending supplementation for your plan, especially if you're transitioning to a plant-based diet, and they're recommending products that have proprietary blends, then I would also hold back. Only because when there's proprietary blends in supplements, they're not telling you what the dosing is, and it is dose dependent. So there is a dose response relationship, like with many other pharmaceuticals, that says you have to have at least this amount to get some of the support and some of the benefits you're looking for.
Again, if you're going to take the time to supplement, pay the money for the
Right.
supplements, you may as well know that you're getting what you need
Yep.
to support your lifestyle and your lifestyle goals, and also that that your body is using it, you know. So again, making sure that it is well absorbed.
Yes.
And you know, that's what we've got for you today and the 8th nutritional principle. If you're watching this on YouTube, please subscribe. You can comment. If you're watching this on Facebook, share. Always, we're available for comments and questions, and we'll see you next time.
Bye-bye.
Bye.